All right, welcome back and thanks for staying with us. So we're interrogating Dr. Cliff behind the scene.
Thanks,
and but we wanted to talk about the maternal mortality rate in Nigeria. It is worrisome. And this is avoidable. So I think I took a story about, was it Enugu State, a week or two ago, where the governor was able to provide data about how providing primary health care centers had reduced the rate of maternal mortality within his states. Now I want to ask you, what do you, based on your what AMPA has been doing, going and coming, what have you seen as what we can do as a country that can trigger the highest number, like the margin that can shoot that margin from where it is and drop it?
Bring it down. Yes, very good. And actually, you already gave the answer, starting in Enugu State, like you said. And like I said before, primary care is a key for us, Nigeria, in everything, prevention and primary care. So when a lady is pregnant, once they know, then the prenatal vitamins, for example, how do they take care of themselves? How do they do their prenatal visits regularly? Then, you know, after a while, we can do ultrasound to know, is this a high-risk pregnancy or not? If it's high risk, then we can prepare to deliver in a certain center, and, you know, and if it's not, then we know what to do. So that's the first thing, is getting them connected to a primary health care center for their prenatal visits, right? So, but part of that involves education of the patients, of the populace. A lot of people get pregnant, they don't even go to the hospital, they don't feel comfortable going, right? So the primary health care centers, some of them are old, by the way. They need to be refurbished. I was in Ibadan yesterday with the First Lady, and they've refurbished, I think, about 299 and counting of their primary health care centers. If we can do that and make it so it's nice, and women feel comfortable and safe to come, and know that they'll be attended to. And then once they are plugged in there, when there's any problem or we sense anything, then we can refer them to the next level of the obstetrician to take care of them.
Some states do not lack facility. I think they need expansion, but not that they necessarily lack it. But the practices of the medical personnel is another issue. So if a doctor diagnoses that a person's pregnancy is one that has to be managed because of the nature of the pregnancy, who will inform the people in the lab? The people in the scan room? Because those waiting areas, they would make you, they would, you know, insist that
integration.
Particularly those who have to take blood will tell you, come downstairs.
And yet
you know, so lack of synergy,
synergy
between the departments, you know, creates that. I think that those are some of the improvements you can suggest that
we can advocate for.
So and what you just mentioned, Nima, is such a simple, you know, how you just change a simple part of your process and you would increase. This one is not even facility. This is existing facility and creating better interaction, synergy between all the medical caregivers that you are interacting with. So the doctor is aware, but all the nurses are not aware. The laboratories are not aware. Everybody needs to know that we are working to ensure this person is
that's right.
safe.
We have to work as a team, and that's one of the things we bring from AMPA. When we come in our team, we have pharmacists, we have nurses, we have dentists, we have doctors, surgeons, and non-surgical. Everybody's working together and we know our role. There's no competition. And sometimes here there's some stress and competition, you know, the lab scientists and the pathologists. It shouldn't be that way. Everybody should be focused on the patient, right? You play your role and patient-centered care and good care. And so once the lady is pregnant now, and we talk about this, then we go to the next step. When they have their baby, complications. Maternal mortality is so high. It shouldn't be. One of the most common causes besides infection is bleeding.
Yes, and we don't have enough blood in the blood bank.
So, in fact, AMPA, part of our programs, is not just medical mission. We have training. The first day we came here on the 3rd, we had a program on postpartum hemorrhage at the LCCI Center in collaboration with Lagos State Ministry of Health, where we trained the midwives and the birth attendants to, first of all, recognize and prevent postpartum hemorrhage. And then when it happens, the medications to use.
How many people were in that training?
We had about 70 people in the training. But that's a start. We want it to be bigger. Then after the baby comes, also, infant mortality, you said, is very high. It's 14% or higher, one of them. So we're teaching what we call helping babies survive. Another program AMPA does. In fact, there are is happening right now at LCCI, again in conjunction with Lagos State, where they teach them how to do neonatal CPR.
Atieni, final words from Atieni, yeah.
I was going to ask, because, you see, like Lagos State hospitals, federal hospitals, may get all these from
opportunities.
But where the children die most are these private hospitals.
Right.
Small ones.
We had a man, his wife and daughter, son died a couple of years last year.
Yes.
Very sad story. Nobody's going to the hospital till today. No
Accountability.
No accountability. The man has lost his wife and child. And it happens like that all the time. And all these are private hospitals. So, like, I mean, what you're doing is commendable. But what are we going to do about those
honestly
hospitals?
Okay, that is not what
No, the grassroots, very good question. Actually, in the program, we told the Ministry of Health to bring us the rural hospitals, the representative that came. So we don't just do with the Luth and FMC.
Exactly.
Because they have their own practice. We want those rural people from the PHCs, primary health care centers. Those are the people we need to reach in the grassroots.
Thank you so much.
Because that's where people are dying.
Can I just quickly say something? Because, you know, nobody talks about the fact that what happens to religious and ethnic beliefs when a woman wants to give birth and she needs blood, and then the family or the husband are saying that they can't give her that blood.
That's an
what
ongoing.
happens? You see that do you just not take the consent from the family because you need to keep the person alive? What happens in situations like that?
You don't mind that.
I know.
That's a whole different
topic when we are closing. Thank you so much, Doctor. I'm speaking with the President, Association of Nigerian Physicians in the Americas, Dr. Cliff Eke, and thank you for your contributions. Thank you for what AMPA is doing in supporting the medical sector within Nigeria, and we wish you all the best. We will take a break now. When we return, we are still discussing health. Stay with us. We'll be right back.
Stay tuned. Your View will be right back.